number of people, particularly in young and productive middle ages, falling victims to heart attacks, strokes, and overall cardiovascular disease-related disease burden has emerged as the number one public health challenge in this country. This has great impact on families as well as even results in high economic burdens for the country because of lost productivity and high healthcare costs. The risk factors are well known, but it appears that apart from conventional risk factors like tobacco consumption, high blood pressure, diabetes, Indians have a special propensity for acquiring cardiovascular disease because of high abdominal fat and certain blood lipid abnormalities like low HDL cholesterol and high triglyceride to HDL ratio. So this combination of susceptibility, which seems to start early in childhood because of poor intrauterine nutrition or early childhood nutrition being deficient, and is aggravated in later ages by the kind of living habits that we practice, can lead to a much higher risk in Indians than in other populations. So the important thing is to try and control the risk across the life course by staying away from tobacco, being physically very active because that reduces insulin resistance and reduces the abdominal fat, and of course reduces blood pressure as well. And make sure that our health systems are also better geared up to detect high blood pressure and diabetes and treat them early before they develop into complications like heart attack or stroke. A healthy diet is also extremely important, but in order to make sure that tobacco control and access to healthy diets are possible, we also need policy measures at the government level which can make it easy for people to eat healthier foods and to stay away from unhealthy foods and to stay away from tobacco. Similarly, for physical activity and for pollution control, again, government policies are needed which can have a population-wide impact. So we need both health systems to be geared up for individual risk detection and care, and also policies at the population level which can promote a healthier society, not only for this generation, but also for the next generation.
Spoke for about 30 minutes about the role of inflammation in atherosclerosis, and I talked about how over the last 20 years we've developed a body of evidence that suggests that people that have high levels of inflammation measured as C-reactive protein have an increased incidence of coronary artery disease, and that statins reduce the incidence of major adverse cardiovascular events by two mechanisms: by lowering LDL cholesterol, but also by lowering C-reactive protein. What I talked about as well is recent data using a monoclonal antibody known as canakinumab that doesn't affect LDL, doesn't affect HDL, but does reduce inflammation, reduces CRP, and that this drug has now been shown to reduce the risk of major cardiovascular events and even reduce the risk of cancer. And so we've now learned over the last 20 years that inflammation, as well as cholesterol, is a major driver of adverse cardiovascular outcomes in patients with atherosclerosis.
We talked about the acute coronary syndrome management today. It is very important to recognize that all patients with acute coronary syndrome should undergo very close monitoring in the hospital with ECG and enzyme monitoring. This patient should be then monitored in the hospital and divided into high risk and not high risk patients. All high risk patients should undergo invasive therapy with cardiac catheterization and revascularization if necessary. Very low risk patients can potentially be managed without revascularization. However, this is a very small group of patients, probably less than 20% of patients. We also talked about all different drugs that can be used, including dual antiplatelet therapy and antithrombotic therapy in the talk. Thank you.
This opportunity to thank Dr. Ramesh kapadia for inviting me to this conference on universal healing healthy heart program, and it has been a very successful and very enlightening program, and I really enjoyed attending this, listening to all the eminent speakers, giving myself talk. There are a huge number of participants, they all were actively involved, and I thank Ramesh again, and I also hope that every year he is going to conduct this program and is going to be more and more successful. Thank you.
Heart disease resulting in heart attack is very common in the world. As a matter of fact, it is the #1 killer. It is also very common and the #1 cause of death in India. As the Indian population ages, the risk of heart disease resulting in heart attack is increasing. And we have to find a way to catch people at risk for heart disease and prevent the occurrence of heart disease and prevent the occurrence of heart attacks. And for that, there are a lot of behavioral precautions that we can take. If we are smoking, we should smoke. We should eat healthy. That is mostly plant-based, low refined carbohydrates, low saturated fat, and maintain an ideal body weight. And exercise regularly, lead a physically active life, and if we have high blood pressure, high cholesterol, these need to be treated, as well as if we have diabetes. So if we do these, our risk of having heart trouble will be substantially lower than otherwise. Thank you.
Heart disease is increasing in the whole world, and the reason is that our lifestyle has become abnormal. Out of lifestyle, there are 4 factors: the diet, lack of exercise, stress, and tobacco. Out of which diet is most important. In the diet, if we can take care, we need to be vegetarian, avoid the refined food like sugar and maida and refined oils. Also, we should take less of salt. We should avoid what is called as the trans fats, which are found in sticky or the food which is available outside. We could prevent heart disease to a great extent. It has been shown now that ghee and coconut oil may not be as bad as we thought. They can be taken, but it is the refined food like sugar which is the biggest culprit, and salt should be restricted. And this could have a big impact. Our ancient diet, like Gujarati diet, Punjabi diet, or the South Indian diet, was extremely good. As we start eating outside, we get this disease. So my take is that take food which is made at home and do not use these trans fats and salt and refined foods, and this disease can be prevented to a great extent.
Hello, I am Dr. Dhiren Shah. I am a cardiothoracic surgeon and heart transplant surgeon from SIMS Hospital, Ahmedabad. Today in this HCC 2019 conference, I had an opportunity to express my views and my thinking in front of a very august gathering. And my topic was, after CABG, is it the end of the life? Because what happens is, once a patient is advised a bypass surgery, then there is a lot of fear, a lot of misconception, a lot of illogical thinking behind this, whether a bypass surgery is really required, and if bypass surgery is done, then what will happen to me. So my purpose of this talk was, doing a bypass surgery, if in an indicated patient, in a patient who really needs it, there is nothing to worry, because you get a life of almost 20-30 years after bypass surgery. Because the studies have documented that overall long-term survival after bypass surgery is significantly improved in last decades. And also, there are certain other misconceptions of bypass surgery, that after bypass surgery you are cured and then you don't take care of yourself. But after bypass surgery, on the contrary, secondary prevention is very important, which is to be taken care of. So that is what I really wanted to give the message to the society, and I hope I have been successful. Thank you very much.
I am Dr. Uday Jadhav from the Department of Cardiology at the MGM New Bombay Hospital, And my talk today and lecture was primarily addressed as to whether we can reverse the process of atherosclerosis. I do believe very strongly that in India we will have to be a little more aggressive in terms of how we detect coronary artery disease. It's not easy to do, because these investigation modalities are also not commonly applicable or available at times. One of the simplest one to follow is do a coronary calcium score. The presence of coronary calcium is a good indicator of presence of atherosclerotic plaque in the coronary arteries. It doesn't have any radiation, very minimal radiation rather to say, and it doesn't cost anything, and there is hardly about 5 minutes that it takes to complete one test. Now, having said that, the next part of how we need to address is to try and identify youngsters. Our adolescents and children must have a LDL cholesterol less than 100 milligram per deciliter. That's very desirable. A total cholesterol of less than 150. A LDL above 190 is familial hypercholesteremia, and let us address these patients very early. It's important that we detect atherosclerosis early, because the plaque regression and the reversal of atherosclerosis is almost 2 times what you would see in patients who have established atherosclerosis in the late ages. And therefore, when we look at this modality, you have drugs like statins, plus minus PCSK9 inhibitors, plus minus ezetimibe, and there's nothing about dietary cholesterol and lifestyle modification that should ever be challenged. That's an important part of life. When we do this, there is a trial called as the Cure Athero trial, which is coming up. The Athero trial is going to enroll young patients and bring their LDL down to 20 to 30 milligrams per deciliter in the early phases of plaque, and then wait for the regression to occur for a period of 3 years. The modality of PET-CT or PET-MRI are going to be extremely useful to see and image the vulnerable plaques. And of course, the future is the vaccination against atherosclerosis. After the seminal paper published in European Heart Journal of the 8004 vaccine in mice for prevention of atherosclerosis, I think the future for mankind will be vaccines which can prevent or at least significantly regress atherosclerosis. Thank you.
I will fail in my duty completely. And I really missed out, and I feel very sorry about it. I was a little emotional and then talked everything about it, but now again that providence has given me a jewel in this Dr. Dhaval. Where is he? This fellow. Imagine a person getting a gold medal in DM cardiology and coming to my clinic and waiting for 2 hours to meet me and then tell me that, Dr. Kapadia, I have passed my DM cardiology at the first attempt, but I would like to now practice like you. Can you believe it in these times when a 1 hour of angioplasty will bring you fortunes starting and with me, but he has proven his worth, and he is behind the whole conference. He is the soul behind it. So give him as much.